Researchers say a patient with leukemia in the United States has become the first woman and third person to date to be cured of HIV after receiving a stem cell transplant. The case, presented on Tuesday at the Conference of Retroviruses and Opportunistic Infections in the U.S. city of Denver, was the first involving umbilical cord blood to treat acute myeloid leukemia, which starts in the blood-forming cells in the bone marrow. Since receiving the cord blood, the middle-aged woman of mixed race has been in remission and free of HIV for 14 months without the need for potent treatment known as antiretroviral therapy. And for more on this medical feat, a consultant physician and infectious disease specialist, Dr. Getty Ayawuke, joins me virtually from the United States. Good to have you join us, Dr. Getty.
Thank you for having me.
So how much of a breakthrough is this for medicine? And talk to us about how this works. We understand that this is now the third person to be cured of HIV with umbilical cord treatment.
So, yes, thank you for having me. This is a very important milestone. For a while now, this is the way the cure for HIV has been going towards. And we are figuring out that there are certain patients that have a kind of resistant gene, which we do not know entirely everything about this particular gene. So what happened with this lady was that they took the umbilical cord to cure her leukemia, but the umbilical cord came with a resistant gene for HIV. And so at the same time as curing her leukemia, they were able to functionally cure her HIV. And how that works is that in as much as we're happy about this, it's not going to be something that we give to every patient because it's a very dangerous treatment. Doing a stem cell transplant, what that means is you clean that person's bone marrow of their own cells because their cells are now dysfunctional. That's why they have a leukemia. So you clean their bone marrow and then you replace it by stem cell transplantation, which in this case was umbilical cord blood. To do that, it means you're taking the person's immunity away. So there is a high chance of that person not surviving. And if they survive really good. So in as much as we are happy about it, we should be cautious and let people know that this is not an everyday treatment because the risk for a regular person that doesn't have leukemia will be seen to be much more than the cure for HIV, especially because we have very good treatment for HIV right now. There are other things that are in the market and they're doing researches about. HIV has been with us for about 40 years now. They've been doing researches, but of late, we've been much more enthusiastic because we're seeing more promising results.
Overall, Dr. Getty, where does this leave us in terms of the cure for HIV? You rightly noted earlier that the search for this cure, a lot of researches have been ongoing. But so where does this leave us? Are we closer now or we're just where we were, or where we left off?
Okay, so I have to say that as someone that treats patients with HIV and AIDS, there's been a lot of advancement in this field. We treat patients, it's more reduced to like a chronic illness, like somebody having hypertension or diabetes. I am here to tell you that people with HIV, AIDS, who take their medications daily, and it's one pill a day, have the normal chance to live like everyone else. It's no longer a certain killer as it used to be in the past. So that's one progress. The second one is we're even making more advancements in these treatments. Now I have patients who I give one injection once a month, and there is recently been approved another injection for once in 2 months. So we're making progress. Coming to the prevention side, we've always had PrEP, which is pre-exposure prophylaxis for those people that have partners that are incongruent. Say one partner is positive and one partner is negative for HIV, but they still want to have sex, they want to have kids. We can give them the partner that is negative pre-exposure prophylaxis so that they can at least have a normal life and don't have HIV. And then there is post-exposure prophylaxis, which is for whatever reason somebody gets in contact. If you get to an appropriate doctor, like an infectious disease doctor or even your regular doctor, if you get to them within 72 hours, sometimes I stretch it to 96 hours, you can be given medication for a whole month, that's 30 days, that will prevent that person from getting HIV. So we've made a lot of progress. Now there's vaccines that are being worked on as in before. But let's not forget that, like the COVID-19 that we have, a lot of the technology that they used for COVID was actually technology that they gained from trying to find cure for HIV. So now it's now reversed. These mRNA vaccines are becoming promising for working for vaccines for HIV. So we're still watching. There are a number of
so we have to keep watching where the science goes, basically, and we'll continue to follow that. But interesting development, and we will monitor the fifth person who gets cured from this. Thank you so much for talking to us, as always, an infectious disease expert, Dr. Getty Anyanwoke.
Thank you for having me.